Cool. So let's go into VR and AR. So that's virtual reality and augmented reality. What's the difference between that exactly, and how can that be utilized for our patients?
Yeah, sure. So answering this question now in what is it, November 23?
Yeah.
They're a lot closer together than they were before. So when we started the company, there was a pretty clear divide in hardware, purpose, the way you experience it. Very simply, if you've ever seen the VR headsets, you're putting on a headset.
Okay.
That headset is transporting you into an entirely virtual environment, right? So you're somewhere else.
Yeah.
You're seeing digital display of information, experiencing a virtual environment. So that could be something like you're on an island, on a beach somewhere.
Yeah.
You're sitting in this diner.
Or the metaverse or something.
Exactly. So most metaverse stuff exists in VR, and spatial computing is the catch-all term. And it's more accurate longer term when you think about what these things do, but that's VR. AR is, you're probably familiar with stickers or filters on your phone or Pokemon Go, holding up your phone, you're looking through a camera, a lens, and then on the other side there's a digital asset that's placed in the field of view. So it looks like there's digital game-based stuff, but it blends it with the real world, and then there's mixed reality and combinations of the two. But to answer your second question, how does this apply? What learning science teaches us is which of those things makes most sense to optimize learning based on what the patient's doing. So a very simple case is if someone is doing home dialysis, they have to set up a machine on their own. That can be complicated. If it's depending on the machine, there may not be obvious buttons to press, things to hook up. So imagine if you had a tablet or a phone that you or a care partner could look at and it'll say, now this step, now this step. The same can be done in VR, but you could argue that it's better in AR to have kind of a how-to guide, kind of like Wayfair when you're placing furniture in your living room. Like the couch can fit in the corner. Will it fit in my space, or does this coat look good on me? Same exact idea can apply to placing a dialysis machine and seeing if it's near water in your place, seeing if this is a space big enough for supplies. Imagine like PD.
You can almost make a home visit virtually in a weird way.
So instead of having the nurse have to come out, order the wrong amount of supplies from human error, looking at a space. Now you have the patient go, oh, here's my thing, and it automatically fills it with the supplies.
Oh my God.
We can handle a 2-week supply. We're good. And now that whole thing is taken care of. That's AR. And then VR, I know you and I have talked about this with Todd. Self-cannulation is a great example. And that's the hands-on motor skills side, where you want to really get someone competency, get the number of skills up. We know how important the number of training sessions are when it comes to outcomes and 1 year survival. That's important. And then also, imagine being in a video game while on dialysis that reduces stress, mindfulness, pain management, intradialytic exercise. Imagine being able to do all these things in the VR headset. That's a pretty cool application. So we're still kind of.
Is there a bit of disorientation for patients at all when they're using the VR headsets at all, or no?
This is human factors. The whole how do people, users, respond to the tech, and the combination of designing the environments for the environments they'll be used in is really important. It's critically important. Obviously, you don't want anything you put a patient through to interrupt treatment, to discontinue treatment, to cause them to feel nauseous, vertigo, all that kind of stuff. So, there's a risk, but the content quality matters. So we've gotten to a point where we control for quality. We control for perspective.
I remember I had this apprehension about VR and elderly patients and what it could do to them. But then you have this new data coming out about how hearing loss and lack of sensory input actually leads to worsening dementia, right? And so you wonder, with the sensory input that VR provides, is it kind of augmenting learning and all that kind of stuff?
I would love to see data on that.